Hello everybody, my name is Brenda Prieto, and with the help of my mentor, Dr. Nancy Livingston, we created a study on dental anxiety in Western New Mexico students. The reason I wanted to do a research on dental anxiety is because of my interest in becoming a general dentist in the future. So I would like to understand this anxiety more in order to help my future patients feel more comfortable with their dental care, which will help them continue coming to see me and would just make them much more comfortable. And so these are things that we're going to be talking about throughout the presentation. We're going to start with the meaning of dental anxiety and the importance of understanding it. Then we'll move on to the purpose and the instrumentation of this research. And we will end with the results that we got with a summary. So dental anxiety is defined as an excessive dread of anything being done to the teeth that can result in the lack of dental care. So people who have dental anxiety will keep postponing their dental care, will make up excuses to not go because they don't feel comfortable enough, and they just believe that pretty much that they don't need it, and they just do anything to prevent going to the dental care, which can eventually harm overall their dental hygiene. The purpose of this research is to determine the difference in dental anxiety levels among Western New Mexico students, which we believe will relate to a broader student population of rural Hispanic serving institutions. Also, we would like to assess the impact of demographic variables such as age, year in school, past experiences with their dentist, and how that affects their dental anxiety. We would also like to comprehend dental anxiety more and hope that this will improve oral health. And the results could possibly help dentists understand their patients better and make them more comfortable, which will help them care more for their dental hygiene and want to go to the dentist instead of postponing it. So the instrumentation of this research was a survey, and in the survey we used several instruments such as non-anxiety demographic type questions and self-made questions to understand reasons for anxiety and the ways that people cope. We also used the dental concerns assessment, which focuses on the barriers towards dental care, and the modified dental anxiety scale, which measures dental anxiety. And all of these were put into a survey, which was posted on Canvas. So before I could post the survey on Canvas, I had to go through an IRB process, and they needed to approve everything on this list in order for me to continue my research. So one of the things I had to do was complete a training and get my PHRP training certificate. And then I had to create an informed consent, which would be part of the survey. And once everything was approved, I was able to continue with my research and let people answer my survey by posting it on Canvas, which they would have had to give consent, and they could only participate if they would like to. So for the results of this survey, overall we had 193 students who decided to participate in the survey, which was posted through Canvas. And the results showed that about 80% of the participants rate their dental experience as good or amazing, while 7% rate their experience as terrible. Most participants rate their dental hygiene as important or extremely important. And also, Most students believe that the perfect hygiene consists of brushing and flossing. However, more than 50% believe that they don't have perfect hygiene according to their definition. And overall, when using the dental anxiety scale with Norman Cora dental questionnaire, the students had about an 8 to 10 rate, meaning that their anxiety was moderate with certain stressors that can be managed. Meaning that if we find things to help them cope with, then they will feel a lot better and they will go to the dentist consistently as they should. So in the following plots, this modified dental scale will be used with the questions. And so the number 1 represents not anxious or like no anxiety, and the 5 represents extremely anxious. So using the MDIS questions, we were able to see that about 70% said that they have at least some type of anxiety when visiting the dentist, whether it is slight, moderate, extreme. However, students feel good about having their teeth cleaned, but mostly they feel anxious when it comes to other procedures such as injections, fillings, and having a tooth taken out. So as you can see here, about 45% of the participants feel good about having their teeth cleaned. Now, these graphs show the percentages of people who have anxiety when they're going through procedures such as injections or fillings. And when compared to having teeth cleaned, you can tell that people get a lot more anxious when it comes to procedures. And pretty much the scale goes from mostly not anxious to more anxious to extremely anxious. So it kind of shifts. And it also definitely shifts when people have their teeth taken out. That is not something that they do lightly. They have a lot more anxiety when it comes to this. More than 54% feel extremely anxious when it comes to thinking about having the tooth taken out. So we also, part of the survey was also a dental concerns assessment, which pretty much shows which procedures are the ones that cause the most stress. And so the top procedures that led to anxiety for the study were the sound of drill or scraping during teeth cleaning, the amount of money for dental care, injections, and just the feeling of being numb. And so pretty much these procedures are the ones that bring people more anxiety and should be the ones that they are more aware of how the procedure goes and just like help them cope with them more. And some other anxiety questions from the survey were that we asked them their grade level of dental anxiety, and 65% either have mild or moderate anxiety, while 16% had severe anxiety. And more than 60% said that they use breathing or mindful techniques to cope with their anxiety, meaning that this is a pretty good way to help patients cope with their anxiety during their dental visits. Other ways they control their anxiety is through sedation or medication. So the summary of this research. So dental anxiety affects the dental care of patients, which is why it's important to understand it and to find ways to help patients cope. Dental hygiene is important which is why we need to help patients decrease their anxiety when they visit so that they continue coming and they have less excuses of not going. Breathing exercises can help patients feel better during their visits, which might encourage them to continue seeing dentists and have good hygiene. Understanding this anxiety is important to give patients the best care possible by making them feel comfortable and help them cope through difficulties. Also, this was important to me because I've never had much anxiety when it comes to the dentist. I've always felt pretty comfortable with all my dentists. It's always been fun to me to go to the dentist. So it was nice to see other people's responses and other people's opinions on dental anxiety and how they cope, which I believe will help me become a better general dentist in the future. And now I know that breathing exercises can help my patients feel more comfortable with me during their dental visit. And these are the works that I used. Thank you so much for watching. Let me know if you have any questions. I should be around. I hope you like my presentation. Thank you so much.